and say hello again and welcome to this info session about the 4+1 pathway with the Mailman School of Public Health. I'm Amanda Dye, the Director of Advising and Programs at Beyond Barnard, and I am excited to turn it over to my colleague from Mailman, Ina Rodriguez, who's going to start out the presentation for us. So Ina, take it away.
Thank you so much, Amanda, and thank you all for finding time to join us for today's session regarding our 4+1 info session. I'm Ina Rodriguez. My pronouns are she, her, and I'm an admissions coordinator here at Columbia Public Health. I'm also joined by my colleagues, Charles Liriano, Director of Financial Aid, as well as Julie Davenport, Director of Admissions. And we're just going to go ahead and get started for the sake of time. So what is public health? It's defined as the science and art of protecting and improving the health of populations through education, promotion of healthy lifestyles, and research for disease and injury prevention. So it is a little different from medicine. In public health, we prevent disease and injury, whereas in medicine, you're curing those illnesses. So as public health researchers, practitioners, you're working with communities and populations to identify the causes of diseases, disability, and to implement large-scale solutions. A good example of this is how the vaccine developments how life expectancy has increased by about 45 years, and that's thanks to things like vaccine development, access to clean drinking water. So that is the basis of what public health is. To give you a little bit of history and background about our school, we currently educate about 1,600 students, and that's across all of our programs. We offer the 6 following departments: biostatistics, environmental health sciences, epidemiology, health policy and management, population and family health, socio-medical sciences, and then we also offer a general public health track. We have the following 5-degree programs: a Master's of Public Health, MPH, Masters of Healthcare Administration, Masters of Science, and our 2 doctoral programs, DRPH and PhD. That's just a brief overview about our program. When you apply to our school, you do have to apply to one of these specific programs. So to give you a sense of what each department is focusing on, I have this slide where you can see their coursework. So with biostats, it's actually our biostats department was the first in the nation. And they're addressing emerging areas involving the collection and analysis of massive complex data sets, so big data. Things like probability, coursework like probability, analysis of categorical data. Our environmental and health sciences department, they're focusing on laboratory and population-based approaches to tackle the issues in the field of exposure science, climate health, toxicology. So courses like fundamentals of toxicology, environmental determinants of health. Our EPI students are studying the patterns and illnesses and injury. So classes like clinical epidemiology, application of epidemiology research methods. Health policy and management are focusing on the development, implementation, and evaluation of health policies and the administrative functioning of the health system. So courses like finance, health policy, and political systems. For population and family health, they're studying the legal, policy, and human rights dimensions of public health, particularly in low-income, unstable, or inequitable environments. So they're focusing on like reproductive health, sexual health, migrant populations. They're taking courses like health and human rights advocacy, current issues in sexual health. And last but not least, we have socio-medical sciences, and they're dedicated to understanding the social forces that influence health. So focusing on how health and policy outcomes are influenced by things like race, gender, ethnicity, sexuality, or social conditions such as poverty. So they're taking classes like advanced intervention design, survey research, community-based participatory research. I hope this is useful in kind of getting you to think about what department your interest would be in, just because you do have to apply to that specific department. And this is the overview of the Columbia MPH 4+1 curriculum. So in addition to your bachelor's, which you will earn from Barnard, you will also have the opportunity to study away during the fall of your senior year. So you'll get to come to us during the fall of your senior year to start earning credits towards your MPH. and you are enrolled in what we call the core. And I'll touch on the core in a little bit. Then after that first semester for the spring, you get to come back to Barnard. You finish your bachelor's, you get to take the summer to enjoy yourself, right? And then you come back that final year to complete your your master's. So that's where you're enrolled in your discipline, and that's your department courses. You're also enrolled in integration of science and practice for 2 semesters, and you're also enrolled in leadership. After the first year during the summer, you will complete your practicum. And this is like a field practice experience for you all. I'll touch base on that too in the next few slides. But this is just a general overview of the 4+1 program. So again, your fall of your senior year, you're with us completing the core curriculum. Then the spring semester, you go back to Barnard. Over the summer, you enjoy your life. And then you come back to us that final year for your MPH. Now, we also have a 2-year MPH program, and it looks exactly the same. As you can see, same curriculum. You still have the core, you still have integration in science and practice, you still have leadership and the practicum. The only difference is that the 2-year MPH will give you the opportunity to earn a New York State certified certificate degree in an area of interest of additional expertise for you. So some students either decide to do a certificate in their department or in a different department. It's almost like a minor to your major is one way of looking at it. If you feel like this is a big benefit for you, if you're interested in more than one area, public health, then I do recommend the 2-year MPH instead of the 4+1. So again, the only difference is that the 4+1 does not give you that certificate option. And I mentioned the core curriculum. It is a little difficult to explain, but let's see if we can do this in an easy way. So with the core curriculum, we actually launched this in 2012. And since then, other public health schools have also started a core curriculum because it was really successful. So over here, you see 6 different studios: foundations of public health, research methods and application, determinants of health, public health interventions, global and developmental perspectives, and health system. So these are the 6 different studios. And then within the 6 studios, there are 16 modules. So these are taught by our faculty across our 6 different departments. So you're really getting an interdisciplinary perspective here. The modules do build on each other. So you might discuss an issue in ethics, in foundation of public health, and then discuss how you quantitatively research that issue in research methods. And then you would discuss how the determinants of health will play into the ethical issue in question. So as you can see, the content kind of builds on itself. So some of the courses do run the full length of the semester, like research methods and application, and others will come in at other points. So everyone will start with foundations of public health, and you don't really get into health systems until you're halfway through the term, because you will need some basis in the different areas of public health before you get to those more advanced courses. So it is confusing. It is a lot to manage. So we actually recommend that students are not working or that you don't have any additional extracurricular activities during the core. It's not that the content is difficult. It's just that the time commitment could be a lot to manage because your schedule will change from week to week. I mentioned leadership, how our students are enrolled in leadership, and it is a professional degree. So we teach you leadership skills. So during this course, you will learn how to have effective working relationships and how to implement innovative solutions in the workplace. And that is for 1 semester. You'll complete that during the spring of that 2nd year when you're with us. Integration of science and practice. This is for 2 semesters. So you'll have this for the year that you're with us, your 2nd year. So the 2 semesters is a 2-semester course where you're with a small group of students. We call it ISP, and it's a case-based course where you're investigating how the things that you learned during the core come together. So you'll look at an issue like the one that you see here. So you'll discuss what are the benefits of this policy? How can we implement this? Our students actually love integration of science and practice because you get to apply what you've learned in the core, and then you get to hear from your student colleagues that are in other departments and studying different topics, and you're all able to have interdisciplinary conversations around these issues. For the field practice, like I mentioned, there is a practicum. So all students have to participate in this practicum, and you can engage in research with faculty members, or you can do public health related volunteer work. There are a lot of opportunities to complete your practicum, either in the United States or internationally. And you do complete this during the summer after you've completed that year one, your department courses. And it does vary by department. So it is 6 to 8 weeks. I know, for example, health policy and management has the longest requirement. I believe theirs is the full 8 weeks. And we have a field practice team that does assist you with this process. So they'll provide resources for you. They'll give you a list of different sites that you can contact. Students start their search during the beginning of the spring semester. So that by the summer, you already have your practicum experience. Your department will also assist with finding your practicum. IPE. At Columbia, we love a good acronym. Pretty much is interprofessional education. And this is a requirement. We're located on the Columbia University Medical Center campus. So we're alongside the School of Medicine, nursing, dental, occupational therapy. So on IPE Day, which is actually today on our campus, we cancel classes across the board so that all these students can come together and think about health-related questions. So it's a great opportunity for you as a public health student to help translate to clinical students the idea of how something that they are looking at on an individual patient basis may apply to a population and vice versa. So again, it's a very interdisciplinary program. And you'll be able to complete that when you come back to us for that year. Student life. On campus, we have about 25 active student-led organizations, and they vary. Some are community-based or affinity group-based, such as the Black and Latinx Student Caucus or the Queer Health Task Force. And some are based on your department. Some are based on the type of work that you would like to do. So there are lots of opportunities to get involved that way. If once you come on campus, you feel that there is a need for something, we actually welcome students to start their own group, and we do support that. There's also ground rounds available on our campus. So a lot of opportunities to learn outside of the classroom. And the departments also host different presentations throughout the year that you're all invited to. The Office of Diversity, Culture, and Inclusion has a self-social and global awareness for all students, and we call that SSGA. And this you would complete during orientation. So faculty and students come together to discuss how our privilege and perspectives can influence the way that we engage in public health and scientific work. So that is done right during orientation when students are about to begin the program. We also have a career service team, and this team hosts a variety of workshops such as salary negotiations, mock interviews, resume review. And they like to say, once you are a Mailman student, you're a Mailman student for life. So these resources are available to you even after you graduate from the program. They also host career fairs. We actually had an in-person one on March 24th. So they do host about 2 to 3 career fairs throughout the year. We do provide housing for that second year when you come back to complete your MPH with us. We have a variety of different housing options. There is a single dorm style, which looks like your typical undergraduate dorm, right? You'll have a bed and a dresser. And then and then there's also 1 to 4 bedroom apartments available in the towers. So I welcome you to search the website if you wanted to see pictures of what that looks like. And so that you can see the good job that the career service team is doing. Every 6 months after graduation, we do host a survey where we're asking our graduates, what are you doing with your life right now? So we do have the results from 2022. About 88% were already employed. About 8% decided to continue their education, so either a second master's or a doctoral degree. And about 2% were still seeking employment. So they are doing a great job. I do say the director, Heather Krasna, is an amazing resource. She actually has a book titled 101 Careers in Public Health. So someone's super resourceful leading that team. And these are the different sectors that these graduates were employed in. So you can see a majority, 27%, go into the hospital healthcare system, 17% into consulting work, 7% pharmaceutical company, 9% nonprofit. You could get a sense of the different areas that our grads are going into. And we actually celebrated 100 years of public health last year, of the centennial of our school. And our slogan is public health is everything, because you can literally do just about everything with this degree, depending on where your area of focus is. These are the different job functions that our students have. So we have titles like epidemiologists, researchers, management, administration, program managers, consultants, public health practitioners, communications and marketing. So a wide array of different job functions. And then these are an example of the different employers our students are working in. So you'll see a few marketing firms, nonprofit organizations, government and humanitarian agencies. So again, the career office does host a fair where all of these employers are invited to come and meet our students. So now that I gave you a general overview of our program, if you're interested in applying, now I will tell you the admissions requirements. So it is a two-step review process. You will be reviewed by both Barnard faculty, and then you would be reviewed by us at Columbia Public Health. And all majors are welcome to apply. The only prerequisites we have is at least one semester of calculus, and this is required for all of the departments. But if you are applying to biostatistics, we recommend at least 1 year of calculus and at least a semester of statistics. It is a very quantitative heavy program, so we would need to ensure that you're able to handle the coursework. And if you're interested in environmental health, there is at least 1 year of biology and or 1 year of chemistry recommended. The minimum GPA for 4+1 applicants is a 3.5. So that's it on the admissions front. Now I would like to hand it over to my colleague, Charles Iriano, who will go into the financial aspect of the program.
Thank you, Ina, and thank you all for attending, giving me the opportunity to talk to you guys about the financial aid aspect of this process. And so in these next couple of slides, we'll be talking a little bit more about the cost of attendance and the types of financial aid and eligibility requirements. Thanks. So in terms of defining the cost of attendance, what is the cost of attendance? So the cost of attendance represents the maximum that you can borrow in federal loans, private loans, receiving scholarship funding, fellowships, tuition exemption, or work study. The cost of attendance is comprised of two sections, billable items and non-billable items. Billable items are things such as tuition and fees. Non-billable items is like food, housing, books, supplies, personal expenses. A change in registration status, meaning you change programs from full-time to half-time, adjustment to living expenses, medical expenses, et cetera, can all play an integral role in updating your cost of attendance. And one thing to keep in mind if and when you apply to our program, if you are receiving an outside award that is affiliated with Columbia University and earmarked for tuition, you must report it to the financial aid office because it may affect your total cost of attendance. So this is sort of an overview of what our anticipated tuition and fees will be for this coming academic year. These numbers will look a little different by the time that you apply to the program. There is generally a 3 to 4% anticipated increase throughout each cycle. So right now, our Masters in Public Health 4+1 Accelerated program is $71,194. One thing to really keep in mind is that when you are completing the core aspect of the 4+1 program, you're still considered an undergraduate student. You're not necessarily a master's student yet. You're completing this program while in your senior year of your undergraduate degree. Once you come back to us that following September, that's when you begin the master's portion of the 4+1 program. And that's when you are officially designated a master's student. And so the tuition for the program that you are eligible to complete is the accelerated program for the 4+1. You are charged a one-time document fee of $105. This provides you access to transcripts, enrollment verification forms. Sometimes employers want to verify your attendance. This is also included in this fee. You also have the computer network fee, otherwise titled as the CUIMC fee. This fee. This gives you access to our Wi-Fi network, also to IT services and what goes toward the creation of your Columbia email address. The student activity fee is charged on a per registered semester, and it covers workshops, symposiums, student groups, activities, and goes towards your graduation preparation. The health service fee is charged on a per semester basis for full-time students, and it grants access to all services provided at the Student Health Center. This particular fee cannot be waived. However, the following fee can be waived. The health insurance fee. This is charged, it's a yearly charge, but the charges are broken down by semester. So the reason why the fall charge is far less than the spring charge is because for the spring, you're covered basically for the spring and the summer. So you're covered all the way from January through August. And this covers the cost of health service coverage for medical expenses, appointments, specialists. It can be waived as long as you complete a waiver form via the Student Health Services Office by demonstrating that you have equal to or comparable health insurance. So this is sort of to get you a sense of what the non-billable items are with your cost of attendance. We do budget students for $18,900 for food and housing, which equates to about $2,100 per month. Something to keep in mind is that your budget is comprised of the semesters, or rather the months that you are considered a matriculated student and that you're paying tuition, which is 9 months. Even though you're completing your practicum after you complete your coursework, since you are not charged for the practicum and there are no fees associated with completing your practicum, your budget is comprised of a 9-month academic year. So the food and housing, like I mentioned, is $18,900. Personal expenses is $2,369. Books and supplies, your budget about $1,000. Transportation is $1,143. The two additional fees that you see there are in the event that you do have these items as part of your expenses. So if you do wind up borrowing federal direct unsubsidized loans, then there is a loan fee that is included in your budget. Now, you're not charged this loan fee by us, but it is a loan fee that is charged by the Department of Education. So we include that in your budget to allow you to borrow additional loans in the event that you want to compensate for that loan fee. And the other part of the budget that's also added is a computer purchase. We do add one computer purchase item per student throughout their academic experience with our program. If you purchase a laptop for the use of the program, you just have to submit the receipt and complete a budget increase form to our office, and we will review and upgrade your budget by up to $1,200. Next. So in terms of the types of non-loan based aid that we offer institutional funding, and we also offer special programs funding. In terms of institutional funding, we're broken down to two different categories. You have the academic merit scholarship, which is based off of your admissions committee score and priority status given to you by the department. Historically, 4+1 students have received up to $10,000 for the year, but that is based off of budget availability. In terms of need-based, this is solely based off your FAFSA. We look at whether or not you receive Pell Grant funding, borrowed subsidized loan at the undergraduate level, and have an expected family contribution below $10,000. Typically, these amounts can range anywhere between $7,500 to $10,000. One thing to keep in mind is due to our budget limitations, students who are eligible for, let's say, both, would only receive the higher of the two awards. International students are not eligible for need-based aid consideration. In terms of special programs, this fund is based off of participating in one of our pipeline programs, which many students often do throughout the summer. Some of the programs that we collaborate with is BEST, Primer, Health Career Connections, Imhotep, the Summer of Public Health program, among others. So students who do apply to our program by December 15th and are admitted into the program will receive a scholarship for $30,000 for the 1 year since you are under the accelerated program. Next. These are some external sources of funding that it's never too early to look into. A lot of the deadlines are always going to be in December and January, which is usually around the months that you're applying to the program. Fastweb.com, scholarships.com, finade.org, just to name a few. You want to search often and vary your search criteria and terminology for various results. On our website, under funding options, there are two very specific links that students can utilize. It takes you to a search engine where you can use any keywords in public health to find any sources of funding. And also there may be some state financial aid programs. Look at local church groups, public health organizations who may be offering funding to students who are pursuing public health degrees. Next. In terms of employment opportunities, we do offer a limited number of employment opportunities for master's students. Most notably is work study. This is based off of the FAFSA, and beginning your second semester for new students, you are eligible to apply for work study positions. However, please be mindful that you must have federal work study. For information on federal work study, what the process entails, what type of jobs are available, you can visit fws.columbia.edu. And funding is limited at the graduate level. One thing to keep in mind about funding at the graduate level as opposed to undergraduate level is that we do not receive any federal funding. There is no Pell Grant, there's no subsidized loans, there's no SEOG funding. Most of our funding are institutional. The only type of federal aid that we receive is the federal direct unsubsidized loan, which I'll touch on in the next slide, and also federal work study. Graduate research assistantships are generally department specific and typically are offered to doctoral students, but depending on the program, you may be able to connect with a faculty member who is running a project that aligns with your professional aspirations. Teaching assistantships are available to MPH students during their second year. For accelerated students, they may be available during year one. You may want to contact your department for more information on that, along with if you're an MS student, if you're pursuing an MS degree as well. Departments do have a limited number available of TA positions, and they essentially is sort of just like a regular job. There is no tuition reimbursement for TA, but the amount that you get paid to be a TA can be utilized towards living expenses and or tuition expenses. Next. And lastly, I just want to touch on the federal direct loans and private loans that are offered at the graduate level. So at the graduate level, there is no subsidized loans. So there are no loans that are awarded based off of need. As long as you complete a FAFSA and you haven't defaulted on a previous government loan, then you are eligible for a federal direct unsubsidized loan. The amount that you are eligible for is up to $33,000 for the year. When you complete your FAFSA, you will notice that the FAFSA itself will say that you're eligible for up to $20,500 in federal direct unsubsidized loan. The reason why you're able to get $33,000 is because you're pursuing a professional health degree. And as long as you're pursuing a professional health degree, you are allowed to borrow an additional $12,500 in federal direct unsubsidized loan. The interest rate that is attached to the unsubsidized loan is fixed, but it does accrue the moment that it gets dispersed. Right now, the current interest rate is about 6.54%. The interest rate does change every July 1st. It may either go up, it may go down, or it may stay the same based on how the economy is doing. Lastly, there is a 6-month grace period prior to repayment, so you do not have to start repaying the loan right after graduation. So the other type of federal direct loan that we offer is the Federal Direct Graduate Plus loan. The major difference between this and the unsub is that this is a credit approved loan. It is a soft credit check, so as long as you've established some type of credit, you generally get approved. There is a 4% processing fee by the Department of Education, which we do add to your budget in the event that you want to borrow the actual amount of Grad Plus loan that you are seeking. There is no grace period for this particular loan. However, once repayment is about to begin, you can contact your loan servicer to request what's called a forbearance, which is essentially the same thing as a grace period. The interest rate is usually 1% higher than the unsubsidized loan. Right now, it's currently 7.5%. And the amount that you can request is the difference between your financial aid and your cost of attendance. So for example, if a student's cost of attendance is $75,000 and they receive $50,000 in financial aid, then you're allowed to borrow up to $25,000 in the Grad Plus loan. You must be at least half-time to be eligible, and this application does get provided to you by our office in the summer. Lastly, we have the private loan. which some students sometimes opt to apply for as opposed to the federal direct loans. And the reason for that is because they either have impeccable credit or their parents have impeccable credit, and they get a loan at a much lower rate with a fixed rate as well. But generally, most private loans are variable rates. There is no grace period, and there are no federal benefits to the private loan. So for students who are familiar with the Student Loan Forgiveness Program and various other programs that provide student loan forgiveness, those are pertaining to federal government loans, and it does not pertain to private loans. This is a hard credit check, so it's not as easy to be approved as the direct the Graduate Plus loan and the direct unsubsidized loan. For students who are interested in the federal loans, as I'm sure many of you who are on loans right now, you will have to complete a master promissory note and an entrance counseling form on studentaid.gov. And I believe that's all for financial aid.
Thank you so much, Charles. Yeah, so that's the presentation on our 4+1 program. Please let us know if you have any questions at this time, either by raising your hand, unmuting yourself, or asking in the chat. I know that was a lot of information for a Monday. It could be a lot, but please, any questions? I'll also share in the chat my email address if you wanted time to meet one-to-one to discuss the program again, or if you have any questions. Okay, if you're still thinking about the core, that's okay, take your time, right? But yeah, feel free to ask anything now, or I don't know, maybe you have any questions for Amanda.
Sure, yeah, I'm happy to answer any questions about the sort of Barnard side of the admissions process, which is where I'm most involved, and then hand off to our colleagues at Columbia. We also will continue to offer, besides these admissions requirements, is there a letter of recommendation or essay required to submit? So that's a good question. Applicants to the 4+1 pathway from Barnard are expected to submit 2 to 3 letters of recommendation. So we need 2 letters of recommendation, typically from faculty members, most typically Barnard faculty members, and 1 letter of what we call a letter of support. One of the letters of recommendation can include a statement of support. Basically, the letter of support needs to come from somebody who's going to plan to work with you as a senior and make sure that they're checking in with you about completing your Barnard graduation requirements. So very frequently that letter comes from like a major advisor or your thesis supervisor if you're planning to write a senior thesis. And the admissions application also includes I believe 500-word personal statement. So a short personal statement, not a huge amount of space there, but that is definitely a really important part of the application because it allows you to express your interest in in public health and kind of make the connections to help our faculty reviewers as well as Mailman's faculty reviewers understand kind of what your trajectory is. And in terms of letters of recommendation, Columbia faculty members can submit letters of recommendation. It is pretty much a requirement that the letter of support come from a Barnard faculty member.
So the letter of support can come from a Barnard, but the letter of recommendation can come from a Columbia faculty member. And I just realized my slide didn't touch on that. So thank you for asking the question about the admissions requirements. For that 500-word statement of purpose, for those that are interested in health policy and management, they actually allow 1,000 words. All of the other departments is just 500 words. And there you don't want to just tell us why Columbia Mailman. There you want to tell us your personal public health story. What made you interested in public health? What was your call to action? What occurred? What do you intend to do with your degree? How is this 4+1 program the perfect opportunity for you? And how will Columbia Mailman help you achieve those goals that you're mentioning? I know 500 words is not a lot of real estate, but you do have time to start drafting that out what that means to you. And that's for a strong statement of purpose. For your letter of recs, make sure that you're picking faculty members or professors that are not just saying that you were in the top 10% of the class. While that's amazing, we can see that in your transcript. You want to pick people that really know you well, know your strengths as a student, how prepared you are for this type of degree and this type of program, especially. So I do like to say, a good tip is to give them a draft of your statement of purpose so that they see what story you're telling us, what your narrative is, and they can either elaborate on those points or just touch base on those briefly. But yeah, those are my tips on the statement of purpose and the letters of recommendation. It's a very holistic process other than the 3.5 GPA. So that statement of purpose is really where you get to really shine and tell us why you are a strong student for the program.
Any other questions? Either about the experience of the master's program or the admissions process? So while we're waiting, we typically do offer these info sessions about once a semester. So if you know anyone who's interested in exploring the 4+1 pathway with Mailman, please ask them to keep an eye out for our session that will come up in the fall. Of course, we will also post the recording of this session on the Beyond Barnard YouTube page, so folks can access it there in the meantime. If you've got questions about, kind of figuring out whether the 4+1 pathway, any of the 4+1 pathways are a good fit for you, you're always welcome to meet with an advisor at Beyond Barnard. And if you're pretty sure that you want to, work toward applying to the 4+1, we can also connect you with the faculty liaisons. So we have Barnard faculty members who are folks who are going to be able to talk with you about, kind of the academic implications of planning for this pathway. So, planning your course schedule and your other academic goals, and kind of understanding the fit between your academic program at Barnard and a potential academic program at Mailman. Those are all things that that Barnard folks can help with as well. So do let us know if you've got quick questions. You're always welcome to email them to beyondbarnard@barnard.edu. And like I said, you can also set up individual advising appointments to just kind of talk about your approach to the application. So if there aren't any additional questions, thanks again to Ina and Charles. We really appreciate you being here and sharing all of this info. And for students who are out there listening, definitely think about it and let us know. We are all here to help you. We at Beyond Barnard, as well as our colleagues at Mailman, are happy to talk and answer questions as you're thinking about whether or not this program might be a good fit for you. All right.
Thank you, Amanda, for scheduling, and thank you all for attending.
Thank you. Thank you for the opportunity. Appreciate it.
Wonderful. Have a great afternoon, everybody.
You too. Thank you.
Bye-bye.
Bye-bye.